Okay, we're here with our model patient. We're going to be injecting Juvederm Ultra Plus today, and she's looking to enhance her upper and lower lip. And so we've gone ahead and numbed her up with some topical lidocaine. So that's been sitting on her for what, about 15 minutes or so. And you're feeling pretty numb now?
Yes.
You feel like you're drooling a little bit?
Yes.
Okay. What we're gonna use today to inject the Juvederm is some cannulas. So the cannulas are a nice, safe way to inject all over the face, but I like them a lot because they prevent a lot of bruising and it's more tolerable by the patient. So the first thing I'm going to do is just use a very small needle. Let me know if this is hurting you at all. I'm going to make a little poke right there. You doing all right? Mm-hmm. Excellent. And then once we pass that needle, we're going to be able to pass our cannula, which is just a blunt tip tube here. And it's not sharp, so it's not going to injure any blood vessels or cause any bruising at all. So, you doing all right? Mm-hmm. Okay. And we're going to start with the top lip, and then we're going to go down to the bottom lip. And one of the trickiest areas to start is just to get the cannula to pass through that little bitty hole that we made. So open up your lips just 1 second there. Let me see if I can find that. Okay, you're going to feel something pass across your lips here. It's going to feel a little funny. If it's hurting, let me know. You doing okay? Uh-huh. Perfect. And I'm not sure if that's showing up in the video, the cannula passing across the lip, but I'm just going along that border between the red and white lip. You doing all right? Uh-huh. Perfect. You're going to feel a little pressure here. Mm-hmm. You felt that right there in the middle? Mm-hmm. Perfect. And I'm slowly just going to start releasing the product into her lip, just a little drop, one drop at a time, across the whole lip in a nice even fashion. And the key is to go nice and slow and to just distribute the product evenly throughout the lip. You doing all right? Mm-hmm. Here's that middle area again. You might feel a little something mm-hmm. here. And the Juvederm, the great thing about it is it's got numbing medication, lidocaine, in it. So as we inject more and more, the lip becomes more and more numb. You doing all right?
Yeah.
Good. Perfect. So I go nice and slow. There's no reason to go fast. And just try to inject everything in a nice, even fashion. And I'm concentrating here, but if you guys have any questions, feel free to ask. I'll try my best to answer.
So does this show immediate results, or is
yeah, we'll all see the results right away here. And what I like to do is I'm going to ask our model here to take a look. After I've injected about half of the product, I want her to just take a look and see if she likes what she's seeing. And if she has areas of that she doesn't think that I've addressed, I'd like her to speak up, and then I'll make sure that we get those areas.
Does it appear a bit more swollen and then settle down later?
It will. It'll be a little swollen for a little while, but typically after about a week, that's about what you get. Okay? So I've done just kind of the upper border of the lip right here. I'm going to go and start on the other side here. And can I ask you to put on some gloves and just kind of help hand me some things here? I'm going to make a little puncture again with this other needle right here.
How long will it last? So
this product typically lasts about a year. That's kind of on average what I've seen. In some people, it's more like 9 months. In other people, I've seen it last around a year and a half, even up to 2 years. But on average, I like to tell folks about a year or so. Let me give you that. And I think, I'm not sure if this is showing up on the camera, but we can see that this part of our upper lip right here, just along the border, is more pronounced. It's more volumized than the right side. So we're going to try to match that now with the left side. You okay? Mm-hmm. So again, just going to feel a little something pass across your lip. The middle tends to be a little more sensitive. You doing all right?
Really pretty.
Yeah, nicely. So let's see if we can get this side to be symmetric with the other side.
Yes. Yes. So meticulous. That is looking really pretty.
Yeah, it's filling in nicely. So, and I haven't diluted or reconstituted this product at all. This is kind of, this is 100% just Juvederm Ultra Plus. And let's see how you're coming out. It's looking pretty good here. And then every now and then I just kind of massage the lips a little bit. And let's do a little bit more on this side. And we're going to go to the lower lip and come back and just even everything out. You doing all right?
Mm-hmm.
Good.
So 1 syringe for both lips?
Yep. In this case, you know, everyone's lips are a little different. Some people need more than one. Some people need less than one. So it all just kind of depends on what the patient needs and what their preference is. My goal is typically to go for a natural looking lip. I don't like it to be overfilled. I think folks look a little funny when they're walking around with the duck lips. But you doing all right?
Yeah.
Okay. Sorry, I'm working in the middle again. I know that's a little sensitive, but again, it's got some numbing medication in it, so the more we inject, the more numb it should become. Okay. I'm going to go back and just do the other side a little bit here, and then we'll start on the lower lip. Thanks for switching, Julie. And then I want you to take a look at the top lip and let me know what your thoughts are, okay?
Uh-huh.
The hardest part is just finding the hole.
So it's about a week before you see the final.
Yeah, just there's going to be some swelling that happens afterwards, but at about a week, it's kind of the final result, typically. And I'm just trying to fill in that left side a little bit more. You have a little bit of a cavity there.
So by Thanksgiving, hey.
Just in time for photos, right?
Take a look at you. I got a little bit of your specter. That's kind of like going to the dentist's office with that numbing medication in there. Just going to do a little bit more here.
Is there usually bruising?
You know, I haven't noticed, I've noticed less bruising with the cannula. Now, you can still, definitely one of the risks of the procedure is bruising. Typically it happens on the inside of the lips, as opposed to on the outside, but the truth is anyone can get bruising anywhere. But it can be covered with some lipstick or some makeup. Why don't you take a look and just let me know what your thoughts are here.
That's really pretty.
Yeah. See there?
Oh my goodness, that's so pretty.
You can see it like instantly.
Yeah.
Let's get started on the lower lip, and we'll go from there.
Yeah. Does she have to be careful? Like I saw you massaging the gel around. Does she have to be careful to displace the gel?
It really doesn't become displaced. I just try to massage it a little bit to kind of get any little lumps or bumps that I might feel, just to get it to smooth out a little bit.
Yeah.
But the product more or less just stays right where you place it.
That's good.
And that's kind of why I do all these slow little passes back and forth, because I just want it to stay in that area. Let me see if I can find, open up just a little bit. Yeah, this is the trickiest part, is just getting the cannula in that itty bitty hole. There we go. You okay?
Mm-hmm.
All right. And my personal preference is to have the lower lip just be slightly bigger than the upper lip. I think that's kind of a mistake we see a lot of times is people just go for the upper lip and it just looks a little awkward. But in general, probably the lower lip should be about 55%. It should have about 55% of the volume of the total lip, and the upper lip should be about 45%. And so we've saved most of the product here for the lower lip. You doing all right?
Yeah.
Just coming to the middle, again, that's kind of the sensitive area. You're doing right there. You sorry, you feel that, huh? Okay. You're doing great though. Just hang in there, we're almost done.
So it really lasts a year?
Yep. Sometimes longer than a year. Everyone's a little different.
That's amazing.
You okay? Sorry. And just, I make a bunch of little passes here. Little droplets of the Juvederm go all throughout the lip in a nice even fashion. Along the lower lip, I don't like a sharp demarcation, kind of where the lip is red and white, like I do with the upper lip. For the lower lip, I'm mostly just trying to get volume. Sorry. Okay. I'm gonna go to in the middle again. This area is sensitive. There we go. Sorry about that. Perfect. Take a look. Let me know what you think. And Julie, Julie left me, huh? All right.
Out of curiosity,
Yes.
this little line right here.
Yep. We're gonna come back and fill in this upper part on that left side a little more. I think is what I see right now. We still have plenty of product left to use. Julie came back. Julie, we need you. Where'd you go?
Nick of time.
Dr. Severin is calling.
Open up just a little bit. And Julie, I'm going to hand you this here. Julie, you're on camera, okay? Try to smile. Tell a couple jokes like you always do.
I'll leave that up to you.
Do your knock-knock jokes.
I want to see a dance routine.
Well, don't hold your breath.
You doing all right?
Yeah.
It's amazing to see instant results like this.
Yeah, it's really gratifying just to kind of look in the mirror and say, hey, that's what I was looking for, and we're done.
So cool.
Nice little office procedure. Julie, can I hand you this? I'm just going to massage your lower lip a little bit, and then we're going to come back and work on that left upper lip a little bit. Let me take a look at you here. You need more in your lower lip. Let me keep going here, okay? Going to the middle. You doing okay?
Yeah.
You should be pretty numb at this point
I
now
know.
that the product's worked its way through your lip. Is that is it coming out in the video at all?
Yeah, you
Is
can
it,
see
is it
it.
coming out okay?
Mm-hmm.
Almost done here. Go over to the other side. Pull in one on that one. And then typically if you want afterwards you can apply a little ice here, you can brush your teeth, do your normal routine. I think you're going to be all right. I don't see any bruising yet. Someone knock on wood.
You're gonna have such a pretty result.
Yeah.
It's really nice.
Looking good. Close your lips a little. Yeah. Alrighty, I like that a lot. I'm going to come and do a little bit of your upper lip on this left side here. Open up a little bit. Let me just... So we've got about 2/10 of the product left. And so I just saved that just to kind of fill in little areas that we want to just do some fine tuning in. So right here, I think she needs a little more. It's really quiet. We don't have our spa music playing in the background. Julie, you don't want to sing a little for us?
Yeah, it's kind of mesmerizing, actually.
Yeah. Sound in.
Just massage you a little bit here. Doing okay? Take a look in the mirror. Now let's just see. I think I have a little product left. I'm going to go for the lower lip if that's all right with you, and then we'll wrap it up. So actually, there's still a little bit more in that upper lip. I see kind of where I'm going to go here. And the rest is going to go on the lower. And some people like to use needles instead. My preference is just cannulas because I feel like there's less bruising, and it's also, in my opinion, it's safer. You're less likely to injure a blood vessel. And I think it's more comfortable for the patient, but you've been doing great.
You too.
I couldn't have done it without Julie. Even though she didn't sing for us today, she'll be singing for us next time. Last little bit here. Last little bit of massage. Put your lips together. Clean up these corners a little bit.
Thanks.
Drool. Your drools. So I'm gonna take a look. All right.
Oh, beautiful.
That's probably pretty close to where it's going to be too. Now over the next hour or so, it's probably going to start swelling up a little bit. But right now, I'm expecting about a week when I see you back. This is more or less what it's going to be. Okay? Looks natural. Doesn't look overdone.
Beautiful.
There you go.
That looks great.
All right. Thanks, guys.